Thank you very much for the introduction. A very good evening to all the esteemed guests present here today and my dear colleagues. I am deeply grateful to Sorkon and Dr. Khemani for granting me this opportunity. I realize I'm the final speaker of the day and I am as eager as you all are to end this. Let's begin. I will skip the introduction part which has been covered by the previous speakers. Straight on to assessment. So in my clinic, if a patient with OA hand has been referred, we begin with the history, not going into the details. I basically need to understand what changes in daily activities or lifestyle adaptations the patient has made because of his condition. If there are any previous treatments and what their outcomes were so that I understand what didn't work out for him. Considering comorbid factors which may hinder in my treatment plan. Understanding the patient's emotional response to their condition and what they hope to achieve through physiotherapy, assessing the patient's readiness to participate in exercise programs and adherence to prescribed orthosis if recommended. Because we know हमारी जनता को exercise करना अच्छा नहीं लगता है. It is important to classify the functional limitation. That is, if the issue that the patient is facing lies in the power grip or precision grip, power would be a spherical, cylindrical or hook grip, and precision would be a pinch or lateral grip, and according to the activities that they describe they're facing difficulty in. We assess and record active gross hand movements such as the full fist, claw, house top, O sign in all the fingers, spreading the fingers and a lateral pinch, and we record if it is easy, difficult or not possible. The joint assessment protocol will be recorded in terms of the joint, whether it's MCP, PIP, DIP, if it's of the index finger, middle finger, ring finger, or the little finger or thumb. We look at the passive range of motion in degrees of flexion and extension using a finger goniometer. If there is a degree of restriction such as mild, moderate, or severe, and severe is almost close to immobility. We record the pain characteristics as well, if there is just joint tenderness, if there is end range pain, or if there is pain during movement. And similar recordings are made for the thumb. Clinically, different types of dynamometers are used for assessing grip strength and pinch strength. The handheld functional dynamometer, it is the commonest. We take a best of 3 trials as strongly they can make a grip. We even record individual fingers if needed. The variable grip dynamometer, which is useful when there are restrictions in patient's range of motion, which might affect their ability to perform a full grip. It allows for adjusting the grip width or configuration so that the patient can comfortably perform the test in their available range of motion. And the pinch dynamometer to measure the pincer precision grip and the lateral precision grip. These dynamometers are very valuable tools in assessing muscle strength as they provide quantitative measurements that help in diagnosing our conditions, tracking progress in rehab, and determining functional limitations. Sir showed one function where even if it did not, the pain wasn't taken away, a bad habit went away, but this function cannot be taken away. Anatomically, the human thumb is crucial because of its opposability. Opposable thumbs allow human to grasp and manipulate objects with precision and dexterity. Guru Dronacharya knew the importance of the thumb, and that's why he asked Eklavya for it. We've seen that any pathology in the thumb makes hand function difficult. Dynamic stability of the thumb base, that is the CMC and the MCP joint, become very important in terms of rehab as well. The thumb indeed plays a crucial role in movements which are essential for performing a wide range of tasks necessary for daily living regardless of age. The treatment goals essentially are pain relief, improved hand strength and range of motion, reduced stiffness and improvement in dexterity with an overall goal to improve physical hand function. Treatment protocols shall be exercises, that is mobility and strengthening, manual therapy, functional training, pain relief modalities, splinting, education about the condition, importance of compliance and coping strategies with the adaptive equipment. And I promise to show you all this without using the smiley ball. We start with small joint mobilization. The overpressure technique involves applying manual pressure to push the joints into their end range of extension or flexion in the DIP, PIP, MCP using a rhythm of pressure on, pressure off. If there is severe stiffness in the joints, then we may sustain the end range extension or flexion for 2 to 3 minutes. This prolonged hold helps in stretching and increasing the tissue elasticity. If necessary, we mobilize the end range flexion of the MCP joints either collectively or individually, and then the focus shifts to retraining movement patterns. There we go on to strengthening the small joints. Therapy provides excellent resistance right from the start of movement, unlike the resistance band that typically offer increased resistance as you stretch them further. This is advantageous for targeting the outer range of motion where muscles often need more strength, and holding the stretch position helps in building endurance. Therapy and resistant bands are available in various levels of resistance, allowing for progressive overload as strength improves, and can be used in multiple directions to target different muscles and joint angles. And the thumb does enjoy a separate time session of its own on similar principles and tools in all the planes with a little more added resistance. Now, integrating it all, we have to look at the overall grip using a simple hand grip per se in different positions, using the therapy in making a fist, a digit strengthening tool for dexterity and strength, playing between pressures that can be repeated or sustained. A really soft ball for strength in the pincer and lateral pinches, manipulating a numbered ball for dexterity, a weighted ball for plyometric training, simple tools for coordination activities like tying a knot, and adding plyometrics for pincer strength. We then come on to the wrist and forearm exercises. These not only enhance the range of motion and muscle strength, but they also boost confidence in performing daily activities. It results in better hand and arm coordination, improves the fine motor skills, reduces fatigue, promotes confident indulgence in sports, higher endurance levels, better bone density, and with better muscle definition, better aesthetics. Proximal muscle strength ensures controlled distal function, so shoulder and elbow strengthening also plays an important role in an OA hand rehab. As we can see here, utilizing diverse tools and resistance levels ensures a personalized approach to rehab, mimicking a variety of functional skills, addressing to all the unique needs of each patient, making them confident not to surrender to pain, thereby making the OA hand rehab indulgent and enjoyable. It is a painful condition, and the recovery does not have to be a race. It has to be a motivating process, which is to be believed in and experienced. The patient cannot be under stress that they have to go and see their physiotherapist today. Integrating myofascial release techniques, both manual and instrument assisted alongside exercises, is a comprehensive strategy for enhancing functional outcomes. And it's not as dangerous as it looks in the video, a little painful though. Empowering patients with self-care techniques further supports the rehab journey and improves the overall quality of life. Joint protection principles. Using wide, non-slip handles that place less strain through the small joints of the hands. Alternative ways of doing things, such as using a straining spoon to get items out of a saucepan rather than lifting it and tipping. Multiple trips from the car to the house instead of carrying all the shopping in one go. Using as many joints as possible. Using larger joints. Using your joints in position where they're in a good natural alignment, and avoid doing tasks in awkward positions. Like from getting up from a chair, instead of using fingers, you bear weight on the palms of the hands. If you do a lot of work in one position, such as sitting on a computer, you build movement breaks into your day and regularly take your hands away from the keyboard to do some stretches. Invest in ergonomic equipment to make the activities pain-free and enable better function. There are plenty adaptive equipment to aid function available in the market. For example, from doorknobs and key turners at home to long zippers while dressing up, special tools in the kitchen, tap turners in the bathroom, smart screens or softwares at work, keeping all the joint principles in mind, whatever suits your work and budget. Now, it is essential that everyone, regardless of their condition or diagnosis, feels valued and included in the society. This involves ensuring they have opportunities to continue working or pursuing activities they enjoy without feeling limited by their health. Education and awareness play a vital role in this process. By informing the public about available options and support systems, we can reduce the stigma and empower individuals to seek help when needed. Custom orthosis. Advancements in low-temperature thermoplastics have indeed revolutionized physiotherapy by allowing the creation of customized biomechanically effective splints that are adaptable to each patient's needs. These new materials not only enhance the comfort and compliance of splint, but also improve their therapeutic effectiveness by ensuring a better fit and support. Also provide us the option of making a resting or a functional splint as required by the patient. Now, does all this help? There are not as many studies, but whatever are there say that the exercise programs tailored for OA hands have shown promise in improving symptoms such as movement, strength, and overall quality of life of the patients, especially during the period of participation. While there has been research on exercise interventions for knee OA and hip OA, studies specifically focused on hand OA are relatively fewer. However, existing evidence suggests that similar principles of exercise therapy, such as strengthening and range of motion exercises, can be effective for hand OA as well. In a recent systematic review published in June 2024, concluded that while there is evidence suggesting long-term improvements in pain, stiffness, hand function, and grip strength with exercise-based rehabilitation, the certainty of this evidence is low to moderate. However, the review also pointed out significant challenges due to the lack of standardization in rehab protocols and adaptation of patients to changes in function, which can vary widely based on cultural and individual factors. We must also note that the cultural considerations for patients in India adapting their activities due to pain is crucial in understanding the broader context of rehab outcomes. आटा बांधने और रोटी बनाने में तकलीफ हो रही थी, तो अब मेरी बहू कर लेती है या अब मैंने बाई रख ली. OA hand is indeed a challenging condition, causing significant pain and impairing functional capacity. It imposes emotional and financial burdens on patients, caregivers, and the society as a whole. Understanding the biomechanics of the hand helps clinicians develop effective strategies such as orthosis interventions, exercise programs, and joint protection methods. Addressing barriers to early referral and adherence to rehab programs is crucial for improving outcomes. Collaboration between physiotherapists, primary care physicians, imaging specialists, rheumatologists, and hand surgeons is essential throughout the diagnostic and treatment process, including pre- and post-intervention or surgery. Advancement in scientific understanding and strategies to enhance rehab show promise for improving outcomes in patients with OA hand. Ultimately, the goal is to mitigate pain, improve function, and enhance the quality of life of individuals affected by this debilitating condition. Because strong hands make strong impressions and create memories. These are some pictures from my clinic, and this is my wonderful team. Thank you.